Welcome to the Physiotherapy in Pregnancy Care class. This class is directed towards all women birthing within Monash Health. We are so excited to have you join us in this class. And we're also extremely excited for you and your families as you take this wonderful and amazing journey of pregnancy. To get the most out of this class, we hope you are watching this class as early into your pregnancy as you can, as a lot of our advice is preventative. Please make sure that you have a piece of paper and a pen, as we will be asking you to write down some notes. This can also help assist your learning. Please also feel free to write down any notes of your own or jot down any questions that you have for the physiotherapist that you can raise in your next pregnancy care visit with your midwife. They can organise a physiotherapy referral for you if you require one. On the last slide of this video, there will also be an email address that you can send any physiotherapy specific questions to. This class will be separated into two sections with a break time in between. The first section is all about changes and management during pregnancy. The second section is all about exercising and stretching. So please settle in and make yourself comfortable. Go grab a glass of water, a cup of tea, or perhaps even grab your partner and sit them down next to you to watch this video. This video will last for approximately 1.5 hours, allowing for a little bit of a break in between. Remember, you can pause whenever you need a break or re-watch parts that you need to. We will be going through some of the changes you experience in pregnancy and the common concerns patients present with to do with pain and difficulties doing your regular activities like exercise. Hopefully this may help you answer some questions you have, solve some problems you are having, or better yet, prevent issues that are common during pregnancy. If you are able, please write down one positive thing that you have experienced during your pregnancy so far. Then write down one challenging aspect you have experienced during pregnancy. Some positive examples given by women include being really excited about the baby, feeling closer with my partner and family, and getting some special attention from the public. Some challenging examples given by women include pain with walking, difficulty sleeping, and also being worried about recovery after having the baby. Many changes we experience during pregnancy are normal and have wonderful reasons behind them. We will now look a little bit further into these changes to learn what is happening to our bodies and why. Firstly, let's have a look at the side view of a woman's body prior to pregnancy. There's a few things I want to point out while we're here. This arrow is pointing toward the diaphragm. This is the muscle that controls your breathing. Prior to pregnancy, you have all the room above the diaphragm for the lungs to take a really deep breath easily. This next arrow is pointing towards the intestines. This is where the food travels through our bodies and where all the nutrients and water come into our body system. You can see they take a very large amount of space within our abdomen. This next arrow points towards the uterus, where the baby grows. This uterus is currently empty. This is the bladder, where urine is stored until the time to go to the toilet. This is the rectum, where the stool or poo is stored before going to the toilet. I also want you to take notice of the natural and normal curves of the spine. This is the tummy muscles running down the front of the body. What changes can you notice already at 6 weeks? That's right. Even though it's small, there is a baby. Can you see what is joining the baby to the mother's uterus? This is called the placenta. The placenta is a very amazing organ. It is created purely for the purpose of providing nutrients to the baby to help it grow. It is a diffuse network of blood vessels that passes nutrients from the mother to the baby. So the blood of the mother never actually mixes with the baby. That's why you can have a different blood type to your baby. There are so many positive nutrients that can come from mum to baby. However, we also need to think about negative things that could potentially come across the placenta to the baby. Can you think of any? Alcohol. The safest option is to not drink alcohol at all. Even a small amount of alcohol can harm an unborn baby's development and may have lifelong effects. Caffeine. Limit your caffeine intake to 200 milligrams per day or less, or avoid it altogether. For example, an instant coffee is 80 to 120 milligrams, or an espresso or a cafe brought coffee is 105 to 110 milligrams. Having high amounts of caffeine may increase your risk of miscarriage, experiencing a difficult birth, and having a baby with a low birth weight. Smoking. If you smoke whilst you are pregnant, you are at increased risk of a wide range of problems, including miscarriage and premature labour. You are also twice as likely to give birth to a low birth weight baby compared to a mother who does not smoke. Low birth weight babies are at greater risk of death and are more vulnerable to infection, breathing difficulties, and long-term problems in adulthood. Most women take some kind of drug, substance, or medication during pregnancy, sometimes without realizing the potential for harm. Drugs or medication taken by the mother may cross the placenta and reach the developing fetus. The possible effects may include developmental delay, intellectual disability, birth defects, miscarriage, and stillbirth. You should always give your doctor, midwife, and pharmacist a full list of all the medications you take or have recently taken, including prescription medicines over the counter, nutrition supplements such as vitamins, complementary therapies such as herbal medicine. You should also tell your doctor or midwife if you smoke, drink alcohol, or take non-prescriptive medication, even if you only take them occasionally or socially. If you need any assistance with any of the topics above, please talk to your GP, obstetrician, or your midwife. Please make a note of any changes you can see here at 20 weeks. Let's start with a growing uterus. The uterus, which your baby is in, can be felt at the level of your belly button now. Your intestines are squished up. The pelvic colon and small intestines are crowded upward and backward. This can slow down digestion and cause constipation in some women. Now let's have a look at your bladder. As you can see here in this picture where the arrow is pointing to, your bladder is now compressed. Some women report of urgency, which is the feeling of needing to rush to the toilet quickly, and or frequency, which is the feeling of needing to go to the toilet often. These symptoms can also be the symptoms of a urinary tract infection. So, if you experience any pain whilst you are going to the toilet to wee, discoloration in your urine, or the smell of your urine is odorous, it may be worth getting tested with your GP. Now let's have a look at the changes in the breast. Many hormone changes are occurring in your body as it grows your baby, getting ready for birth and for breastfeeding. As a result, your breasts change quite early in your pregnancy and will continue to do so throughout the pregnancy and after the baby comes. Consider getting expertly fitted for the right bra size around this time. These bras can usually be adjusted throughout the pregnancy and beyond as needed, or you may need to purchase several bras. Look for bras with thick bra straps for more support. Also have a look at different types of maternity bras in different types of stores. There are very affordable maternity bras. You don't always need to get the most expensive ones. Having a well-fitted maternity bra can help prevent shoulder and back pain from developing during pregnancy and after the delivery. Make sure you also start to take notice of your posture, as your growing breasts may tend to pull you forward into a hunched posture instead of standing and sitting up tall. We will be talking about correcting your posture later in our presentation. Now let's have a look at the changes your body goes through at 28 weeks. Your baby is about 16 inches long and weighs between 1.5 to 2 kilos now. Make a quick note of the changes you can see with the progressing pregnancy. Again, the intestines are further compacted with a growing baby. This also is putting pressure on the diaphragm. Around this time, women report that they feel they aren't able to take a deep breath and are worried they're not getting enough oxygen and can feel panicked. The human body, though, is amazing and makes many adaptations like this. As you are not able to take as big of a breath as you did previously, the body actually becomes more efficient and effective at processing this new smaller breath and bringing in oxygen and getting rid of the old breath, the carbon dioxide. The pressure on the bladder sometimes gets a little bit better at this time as the tummy has popped out and moved out front rather than further down onto the bladder. The tummy muscles you can see have had to stretch to allow room for the growing baby. Now this is normal and is assisted with hormones, which we will talk further about later in this video. How impressive is this? Your body is now at 40 weeks of the pregnancy. Every time I look at this picture, I am in total awe of what the human body is able to do. The baby's head is now occupying most of the pelvic cavity. The colon is compressed against the sacrum. The uterus is a long bag of muscle that is holding the baby. The uterus is now taking up an increased amount of abdominal space, causing increased pressure on the bladder and bowel. As you can see here in this picture, the bladder is compressed between the baby's head and the pubic bone. This can sometimes make you feel like you need to empty the bladder twice. Try and empty the bladder just once, then gently move your pelvis around or rock it forward and backward. Then relax to see if more urine comes out. There is a ligament called the round ligament attaching from the pubic area on each side. Sudden movements or twisting may result in sharp pulling pains, like a stitch in the tummy. To avoid experiencing this, change directions gently and avoid walking large dogs that may pull on the lead. You may also feel more supported if you have your hand supporting your abdomen with activities and movements that cause you discomfort, such as twisting or turning. Weight gain is, of course, another change that can happen during pregnancy. The average amount that women gain in weight in pregnancy is between 10 to 15 kilos, which can sound like a lot. However, when we think of what makes up that weight, it makes sense why women gain this weight. This weight includes the baby, which is around 3.5 kilos at full term, the uterus, around 1.8 kilos, the placenta, which can be 0.7 kilos, extra breast tissue, as mentioned earlier, which can make up 1.5 kilos, extra fat stores, which can make 2.5 kilos, and extra body fluid and blood, making 2 kilos. Therefore, remember, this weight gain is completely normal and healthy during your pregnancy. However, if you are worried about weight and would like further guidance around healthy weight gain during pregnancy, please speak to your treating team, such as your midwife or obstetrician. Despite so many changes occurring during pregnancy, remember most of these changes are completely normal and positive too, and it means that you are growing a healthy baby. As we mentioned earlier, there are natural curves to our spines. The spine dips in at the neck, out around the chest, and then in again in the lower back area. During pregnancy, the weight of the growing baby can sometimes exaggerate these curves and then cause pain, particularly in the lower back and pelvic area. As your tummy grows, it wants to pull your center of gravity forwards and your tummy and back with it. It is important to try and pull your tummy muscles in to try and prevent your lower back from dipping forwards too much. Similarly with your thoracic spine or the middle part of your back around your chest and shoulders. There is a tendency to hunch your shoulders forwards and curve your spine as your breasts grow. This can cause pain in the shoulders, spine, and chest. Try to keep your shoulders back in line with your ears and bring your shoulder blades down and back together. Now let's try correcting your standing posture. Firstly, try and stand with paw posture. As we mentioned, round your shoulders, let your tummy bulge out. Now feel your body as you make these corrections. I'll give you a bit of time to stand up and try that posture. Now, I would like you to try lift through the crown of the head as we improve your posture. Try bring your shoulders down and back whilst lifting up the rib cage and pushing gently your chest forwards. Tuck your bottom in and pelvis under, gently pulling in your lower abdominal tummy muscles. Relax your knee joints slightly to ease the body weight over both your feet and distribute your weight evenly through the center of both your feet. And already you should feel that it is a much more comfortable posture. However, standing in any position, even if it's a good posture, can cause discomfort in the back. So, try avoid standing in the same position for too long. Try and change your posture every 30 to 45 minutes if you are standing for long periods of time. Okay, now let's try correcting your posture in sitting. I'll give you a moment to sit down onto a chair. Now, sit upright with your bottom touching the back of the chair. You could also try sitting with a back support. As you can see in this second picture on the right, you can get a towel, roll it up into a little sausage, and then pop it into the lower half of your back. You then want to keep your body weight even throughout both your hips. Keep your hips and knees at a right angle. Try and avoid crossing your legs and twisting when you're sitting. Same as standing, we want to try and avoid sitting for long periods of time. Even when you're sitting in a good posture with a back support, sitting up tall, we recommend that you change your position every 30 to 45 minutes to ensure that you are changing your posture. This is particularly helpful and important if you work in a job that requires you to sit for long periods of time. Ensure that you are getting up and moving around regularly to help prevent back and pelvic pain. Now, let's move down to your pelvis. It is here where a lot of changes can occur. From early on in the pregnancy, the body starts releasing hormones, such as relaxin, that relax the ligaments, muscles, and tissues in your body. This is so the body can stretch to allow the growth of your baby, but also so the pelvis can now relax to allow the passage of the baby through during labor. There are 3 joints in the pelvis. 2 at the back, called the sacroiliac joints, here and here, and 1 at the front, called the pubic symphysis. These joints are very strong, and when you are not pregnant, these joints barely move. During pregnancy, these joints start to move very gently to allow the pelvis to widen. Sometimes in doing so, this can cause women to experience pain and discomfort in these areas. 50% of women will experience lower back pain or pelvic pain during their pregnancy. However, only 25% of these women will need medical help. Typically, lower back and pelvic pain is a combination of hormonal changes and postural changes, as we've mentioned earlier in the video. Back pain and pelvic pain can arise at any time during pregnancy. And remember, The earlier you can pick it up and treat it, the earlier, the better. So make sure that you don't avoid any back or pelvic pain that you experience during the pregnancy. The most common activities that cause or aggravate pelvic joint pain are getting in and out of bed or the car, going up and down stairs, rolling over in bed, walking, particularly if you are walking for long periods, and even standing on one leg to get dressed. Any activities that usually involves more pressure or weight on one leg than the other can typically aggravate or cause pelvic joint pain. There are several things that you can do to prevent or treat your pelvic joint pain. Most women can reduce their symptoms just by trying these easy tips. When getting in and out of bed, try rolling onto your side. Swing your legs to the edge of the bed, ensuring that you keep your knees and ankles together, and then use your arms to push yourself up. You can see this in this picture located on the slide. When you get in and out of the car, try and swivel to turn to get out of or into the car, keeping your knees together. Try to wear comfortable and supportive footwear like runners or joggers, or avoid wearing high heels or bare feet, which can increase your symptoms. If you get discomfort when walking, try to take smaller steps rather than striding out with large steps. Try to imagine that you're wearing a miniskirt throughout the day, which will help remind you to take small steps and keep your knees together with daily activities. This can also help to decrease the discomfort in your pelvis. Try to avoid standing on one leg. Therefore, sit down when you're putting on your pants or your socks or your shoes. If you're swimming, try and avoid breaststroke, as this can put more pressure on the joint at the front of your pelvis. Freestyle is completely fine. When standing up, try to keep your weight evenly between both feet. Try not to hang off one hip with all your weight on one leg. This can be particularly important for the mums who have toddlers or other young children at home that you need to hold and carry. If you feel like you've tried all of these things that we've mentioned and are still having issues, please make sure you speak to your midwife to organise a physiotherapy referral for a one-on-one consult and for more advice and treatment. Often it can be quite challenging to find a comfortable position with your changed body shape in pregnancy. Here are a few suggestions you might like to try to find added support and comfort. Sleeping on your side is often the most comfortable position. We also suggest that from 28 weeks to avoid sleeping on your back. After 28 weeks of pregnancy, lying on your back presses on major blood vessels, which can reduce blood flow to your womb and oxygen supply to your baby. Recent research has confirmed that going to sleep on your side halves your risk of stillbirth compared to those sleeping on your back. You can go to sleep on either the left or the right side. Either side is fine. It's normal to change positions during sleep, and many pregnant women wake up on their back. That's okay. The most important thing is to start every sleep lying on your side, both for daytime naps and at night. If you wake up on your back, just roll over to your side again. Using extra pillows in between your thighs and knees can help take some pressure off your pelvis. It is best to try and get your knees and hips in line, as in the very top picture there with a green square. This takes the most pressure off your pelvis and feels a lot more comfortable. Try bending your knees or keeping them straight. Everyone's a little different to what feels comfortable for them. You can also try a pillow or blanket underneath your bump to support your belly, which can also feel more comfortable. You may have heard or read the term DRAM, which stands for Diastasis of the Rectus abdominal muscle. These are the six-pack muscles that you see on very fit and muscly men and women. Well, we all have these muscles. There is connective tissue between these six-pack muscles, as you can see in the picture on the left, and it is this tissue that will stretch and separate to allow for more space in your tummy for your growing baby. You will notice this around 24 weeks for some women in their pregnancy. This stretching is a good thing and it is a completely normal process. Some women are told or believe that there is a tear, which is completely not the case. The stretching of this connective tissue will slowly recover after you have had your baby. To reduce the strain on these muscles, when you are getting in and out of bed in your pregnancy, try the log rolling technique that we discussed in the earlier slide. This is where you are lying on your side, you swing your legs off the edge of the bed, then use your arms to help you sit up sideways. Please refer back to the pelvic joint pain slide 2 slides ago to review this if you need. When we lift, a lot of pressure goes through the back and through our pelvis. This can be problematic for your back and pelvis, as well as problematic for your bladder, bowels and pelvic floor. Therefore, we recommend not to lift anything heavier than 4 to 5 kilos during your pregnancy, and nothing heavier than your baby for the first few months after the delivery. If you do need to lift something up, please ensure that you have a think about it first and try do it safely. Firstly, if you do not need to lift, try not to. Get friends and families to assist where able. Otherwise, ensure that you are close to the object that you're lifting. Bend your knees and hips, trying to keep your back straight. You can also try to squeeze your pelvic floor before you lift the object, and that can help support your pelvis and your back. Common types of heavy lifting to think about would be toddlers, prams, capsules, shopping, heavy nappy bags, and wet loads of washing. Remember, when friends and family visit, they really do want to help. Make sure you take them up on these offers and ask, do you mind please helping me with the washing? It's also important to have cuddle time with your toddlers. So instead of picking them up and lifting them, try and encourage them to climb up onto your lap, couch or bed. Some women experience leg cramps during pregnancy. This can be very uncomfortable and can prevent sleep. Ensure you mention this to your midwife or your GP if you have this issue, so you can have it assessed at your next visit. Here are some things that can help. Calf stretches and ankle circles can be particularly helpful, especially right before you go to bed. A simple calf stretch is sitting down with your legs long and then gently pulling your toes and your ankle towards you. You'll feel a nice gentle stretch in the back of your calf. This should never be painful. Try and hold the stretch for 15 seconds and repeat 3 to 5 times on both ankles. Ankle circles are drawing circles with your ankles, so you're turning your ankles around. Avoiding wearing high heels and crossing your legs can also help with leg cramps. Make sure that you also ensure electrolyte replacement if you're exercising and you become dehydrated or if you are sweating lots. Most pregnancy vitamins include magnesium, which can assist with cramps. If you are thinking of taking any supplements, make sure you let your pregnancy care team know before you start taking them. Some women also experience swollen ankles and legs and varicose veins in their legs, which can ache and be quite uncomfortable. This may be worse at the end of the day and after standing for long periods of time. It may also occur if you've been sitting for a long time with your legs hanging down. So that is something to note for the women who sit at a desk working for long periods of time. To avoid swollen ankles, make sure that you don't stand or sit for prolonged periods of time, as we mentioned earlier in the video. Rather, get up and have a small walk around or try periods of sitting or lying down with your legs lifted up. You may want to lie down on your side. Do regular ankle pumps, which means you move your feet up and down, which helps circulate your blood and also helps move any swelling that might be building up in your legs. If you are finding you have swollen legs and ankles and you are quite uncomfortable, you could try wearing some compression stockings. If you are going for a long-haul flight, compression stockings are also recommended. Once again, make sure you speak to your midwife or your GP about wearing compression stockings before you purchase them. Carpal tunnel symptoms can affect 30 to 60% of women during pregnancy. The common symptoms that you may feel are tingling, numbness, pins and needles, weakness in the hand, or pain. This is usually felt over the palm, the thumb, second, third, and half of the fourth finger. This area is seen on the picture on the slide. These symptoms are caused by increased swelling in the hand, compressing the nerve that supplies the hand in the carpal tunnel in your wrist. This is usually a short-term issue that can be managed with self-care and generally improves following birth. To help with these symptoms, try to avoid repetitive activities like chopping, knitting, writing, or any activities that might worsen your symptoms. Holding your mobile in a position where your wrist is bent, texting or talking for long periods of time could increase your discomfort. Instead, try putting your phone on speaker and placing the phone on your desk or on your lap when talking. Alternatively, you could also use your headphones. If you are texting, try and use your index finger instead of using your thumb. When you are getting out of a chair, use your legs to push yourself up out of the chair rather than relying on your hands and your arms. If you are standing or sitting for prolonged periods, try and avoid your hands dangling at your sides. Getting them elevated will help with managing swelling. So try and ensure that you are moving your arms and your elbows or elevating them if you are sitting or standing for prolonged periods of time. If your symptoms remain or worsen, you may need to wear a wrist splint. So please discuss this with your midwife or GP and seek a referral to your physiotherapist. There are so many changes happening during pregnancy with your body and with your life. And we've only just touched on some of the changes that can happen to your body during your pregnancy in this video. There are also really significant hormonal changes. All of this can sometimes have you feeling more emotional at times. It is important to make sure that you have really good support around you. Someone that you can talk to, as well as discussing this with your midwife or your GP. Although sometimes emotional ups and downs are common, we also need to be aware that 1 in 5 expecting mothers experience perinatal anxiety or depression. Please have a look at this Panda website on this video for more information and be sure to discuss how you're feeling in your next pregnancy care visit. Regular participation in exercise and meditation has been shown to assist with mood maintenance, and it also can treat and prevent depression and anxiety. A great source of information on meditation and mindfulness is Mind the Bump, which is also shown here on this slide on the video. This is a great initiative from Headspace. As you have learnt over this video so far, your body is incredible. It really is amazing. There are so many wonderful changes that have occurred, are occurring, and are yet to come that are all normal and part of a healthy, thriving pregnancy. You have also learnt that there are lots of proactive steps that you can take to keep your body strong and healthy throughout your pregnancy and to avoid getting aches and pains. There are also many self-help strategies if you do develop issues, but also make sure that you use your treating team around you. Discuss your issues in your next pregnancy care visit, and your midwife or doctor can organise a physiotherapy appointment if you require. And also remember, if you have written down any questions from the video so far, there will be a slide at the end of this presentation with a physiotherapy email that you can send any questions to. Now, make sure you press the pause button here and grab yourself a drink and a snack. Have a toilet break and move your body around. Have a bit of a walk. As we discussed earlier, sitting or standing for long periods of time are not good for anyone's bodies, especially during the pregnancy. Now, let's get started on part 2 of Physiotherapy in Pregnancy Care class. In this second section, we will be going through general exercise advice. This is not an individualized program, so it is important to seek individual advice if you need. We will discuss the benefits of exercise as well as exercises to avoid and which are the best types of exercise during your pregnancy. Remember, exercise is a part of normal, healthy life for all human beings. And during pregnancy, this is no exception. Now, your turn. On your piece of paper, write down what exercise you were doing 5 years ago. What exercises were you doing before your pregnancy? And what exercise are you doing now? Despite the fact that we all should be doing at least 30 minutes of exercise every day, only 45% of women of childbearing age engage in regular exercise, and only 15% of women engage in the recommended levels of exercise during pregnancy. Why might that be the case? Can you have a think yourself if you are not exercising as you previously did? Why have you stopped exercising? Some of the reasons why women don't exercise during pregnancy include pelvic or back pain. They're really fatigued and tired. They might not have enough time. Fear of harming the baby or miscarriage. Having incontinence during exercise. Unsure what type of exercise is okay and safe, and they might feel uncomfortable too. Hopefully, through our next section, you can learn about exercise, how it's so beneficial for you and your baby, and what types of exercises are safe for you to do. Now, I'm sure that we all know exercise is really good for us normally, but it is particularly important during pregnancy for your health and for your growing baby's health. As we get stronger, our muscles can help provide more support for our skeleton, and women who exercise regularly report less pain in their pelvis and in their back. Despite one of the main reasons for not exercising is fatigue, research actually shows us that women who exercise regularly have greater energy levels and less fatigue. When you are exercising, the movement actually can help reduce the swelling in your hands and legs, and also reduces your risk of developing varicose veins. As we also previously mentioned in the first class, it is common for mums during their pregnancy to experience a lot of different emotions. Exercise has a very strong and important role in preventing and treating anxiety and depression. Regular exercise can also help control blood sugar levels and prevent and treat gestational diabetes. There is also some evidence suggesting exercise and strength and fitness levels can better equip you for your labour. So as you can see, there are so many benefits to exercise, and we could go on and on here. But it is best to summarise that all women should be exercising as they are able during their pregnancy. The clinical guidelines recommend participation in aerobic or cardio and strength exercise every day of the week. Of course, it is always best to get medical advice before starting an exercise program, especially if you have any issues that make exercising unsafe or more challenging. Please refer to these exercise contraindications, and if you have any of these listed conditions, please discuss exercising with your midwife or GP, as it may be unsafe. If you do have any of the above, you may still be able to exercise, but it would have to be with guidance from your treating team. This list of conditions may not stop you from exercising, but again will need to be done under guidance from your treating team. So please ensure that you discuss these at your next pregnancy care visit. As you can imagine, Being pregnant may change the way in which you can exercise, but it shouldn't stop you from exercising. We're recommending ceasing any sport or exercise where you are at risk of sudden contact, like football and basketball. For similar reasons, we also recommend avoiding sports where there is a high risk of falling, like skiing or gymnastics. As you can imagine, scuba diving should also be avoided because of the pressure it puts on your whole body, which can have a negative effect on the baby. Exercise should also be done in a comfortable room temperature, so try and avoid classes like hot yoga or exercising outdoors on hot days. After 16 to 20 weeks gestation, it is also recommended to no longer lie on your back. So try and avoid exercises that you have to be on your back for long periods of time. It may mean that your Pilates or yoga needs to be modified. Cardiovascular exercise is the term given to exercise that gets us moving and gets us puffing, like walking, running, swimming, and cycling. Every woman has a different baseline fitness, and so every woman will have a different exercise program. For example, if you have been a long-term participant in high-intensity exercise, there is no reason you can't continue to exercise at the level if you feel comfortable. Another example, if you are new to exercise and normally sedentary or don't do much exercise normally, it is best for you to discuss your exercise program with a professional such as a physiotherapist or your treating team to get some guidance. You may wish to start with more gentle exercise such as walking, riding a stationary bike, or participating in expert-led pregnancy classes. All women should aim to participate in moderate exercise of 30 minutes each day of either cardio or strength training. We should be working hard enough to start puffing gently, but not so hard that you are unable to talk at all. This is called the talk test. When exercising, ensure your body is well supported. This will mean a good fitting bra as discussed in the first section. Comfortable exercise clothes that are not restrictive, that you can breathe well, and also make sure you are wearing comfortable and supportive footwear. We also need to look out for when we need to stop exercising. These symptoms include chest pain, unexplained shortness of breath, dizziness, feeling faint or having a headache, muscle weakness, calf pain, swelling or redness in the calf, sudden swelling of the ankles, hands or face, vaginal bleeding or fluid loss from the vagina, decreased movement of your baby, uterine contractions or pain in the lower back, pelvic area or abdomen. If you notice any of these signs, stop exercising immediately and make sure you contact your treating team, such as your midwife, GP or obstetrician immediately. If you are quite concerned, you could also consider going to the emergency department or calling an ambulance for immediate care. Strength training is using weight and gravity to help increase muscle strength and muscle size. It is recommended that at least 2 of your sessions should be strength sessions per week on non-consecutive days. Sometimes strength training can be a bit tricky, and it is best done with guidance from a physio, fitness professional, or guided pregnancy exercise classes. If you have no strength training experience, you can aim to perform 1 to 2 sets of 12 to 15 repetitions, aiming to work out the main muscle groups of your body. Resistance can be provided as per these 3 pictures. The top picture is using your body weight, like when you are squatting. The middle picture is using elastic resistance bands, and the bottom picture is using light weights. Please visit this website on the slide, Pelvic Floor First, for some ideas about different cardio and strength training that is safe to do during pregnancy. Now let's talk about another part or muscle in the body that is very important to exercise, particularly during pregnancy, which are our pelvic floor muscles. The pelvic floor muscles are a sling of muscles that sit in the base of your pelvis. They attach behind the pubic bone at the front and the tailbone at the back. These muscles are very important even when you're not pregnant. They're also important for men as well. They support your abdominal and pelvic organs, and they are crucial in bladder and bowel control, and also have a role to play in sexual function. These muscles also support your back and pelvis and have a role in preventing and treating back pain. This is why these muscles are so important, even when we're not pregnant. The pressure during pregnancy, along with the effect of different hormones, can lead to weakness, which can therefore cause problems with the bladder, bowel, and pelvic floor during pregnancy, as well as after the delivery. There are many factors that can increase the risk of weakness and damage to the pelvic floor muscles. Listed on this slide here are various different factors that can lead to pelvic floor weakness. However, it is not all bad news. Hopefully, this class will help motivate you to practice your pelvic floor muscle exercises and get your pelvic floor stronger. The positive thing is that we know that strengthening this pelvic floor muscle during your pregnancy can avoid and treat issues such as accidental leakage of urine as a result of pelvic floor weakness. In fact, the research shows us that this can be one of the best times to start lifelong health benefits and for improved pelvic floor health. So, how do we do pelvic floor exercises? Now, you may find it easier to start doing your exercises when you are lying down or sitting down to start with, before you progress to standing and walking pelvic floor exercises. Now put down your pen and paper. Sitting in your seat, let's have a go. What I'd like you to do is to relax your legs, relax your stomach, and make sure that your feet are flat on the ground. I'd like you to try and tighten around the anus, the vagina, and urethra as if you are trying to stop the flow of urine or stop the wind from passing through. You may feel a squeezing tight sensation as well as a lifting up feeling towards the front of the pubic bone. And now let go, relax. Now we are going to try and repeat that and hold the contraction for a few seconds. So again, tighten around the anus, the vagina and urethra, squeeze, tighten and lift up and hold. 1, 2, 3. Now fully relax. let the muscles go. You should be aiming to try and hold the contraction for 3 to 8 seconds, then fully relax. Repeat this 8 to 12 times. You can also try and do some quick squeezes, where you switch on the muscles, squeeze and lift, fully relax. Repeat that 10 times and do both these sets of quick squeezes and longer holds 3 times a day. It is important that you make sure you try and keep your stomach and your legs relaxed, and make sure that you keep breathing whilst you are doing this exercise. Think of this exercise as a secret exercise, so no one on the outside should be able to see you practicing your pelvic floor when you are doing pelvic floor exercises. Have a think about when it might be the best time for you to practice these exercises every day. For some women, they practice the exercises when they are in the shower, brushing their teeth, or perhaps when they are getting in and out of bed. Other women also practice doing their exercises when they're waiting at the traffic light or waiting for the kettle to boil. Do you have any ideas? On this slide, you'll also see that there is an app that you can download, which provides you with reminders on your phone to practice your exercises consistently. On this slide, there are a few different websites that you can also access that will provide you with more information about the pelvic floor and exercising safely during your pregnancy. Make sure that you also contact your team or the midwife if you require any further information. Stretching can also offer many benefits for women during pregnancy. It can help you relax, and more importantly, it can help reduce some of the aches and pains you may be experiencing. Listed on this slide are stretches that women find helpful during pregnancy to reduce aches and pains. If you haven't been doing stretching regularly, make sure you start gently and slowly. I will talk through 3 of these stretches that you can try. Give each of them a go and see which ones work for you. Some positions may be a bit more difficult to get into than others, so only do what it is comfortable. You should not experience increased pain or significant discomfort when you're stretching. Please refer back to this slide later on and have a look at these different stretches online to get some more guidance around how to do those stretches. Try and aim to stretch 2 to 3 times a week. Lots of mums love this stretch. It's what we call the happy and angry cat stretch. It is really helpful in reducing tension in the back and in the pelvis. This stretch is really great for the mums who work desk jobs where they sit for long periods of time, or if you've had a long day on your feet and you've developed some tension or discomfort in your back. Start in the position of kneeling on all fours as per the furthest left position. Now drop your head, pull your belly up and press through your arms, arching your back up like an angry cat. Then let your back arch down, dropping your belly button down towards the mat or the ground and look up to the sky like a happy cat. Keep your elbows and shoulders straight throughout this movement. Repeat this 10 times. This is called the child's pose stretch. This stretch is really great to open up your chest and stretch your back. It also encourages deep breathing in this position. You can practice this stretch with either a fit ball, like in the picture, or if you don't have one, you can use a chair instead. You can either kneel, like pictured, or sit back onto your heels with your knees spread wide to allow enough room for your belly. Place your arms on top of an exercise ball or the chair and relax your upper body. Take slow, deep breaths. Allow this position to be held for 1 to 2 minutes, taking deep breaths. Reduce the length of time if you need to. Some expecting mums can develop discomfort in their gluteal or bottom muscles and in the back of the leg. There can be various different reasons why this can happen. Please let your midwife or treating team know if you are suffering from this pain so they can put in a physiotherapy referral if appropriate. This stretch can help with reducing the tension in your bottom muscles and prevent bottom pain. Start with sitting on a chair, and you can try this if you are already sitting in a chair. Now cross one ankle over the opposite knee. Now gently lean your body forward until you can feel a stretch in your bottom. Now hold this stretch for 15 seconds, then lean back into the chair, taking the stretch off your bottom. Repeat this 5 times on both sides. In summary, exercising during pregnancy is good for both you and for your baby. You should try and exercise on most days of the week where you have a combination of both cardio and strengthening exercises. Also, make sure you don't forget about your pelvic floor muscles. They are such important muscles, particularly during pregnancy. It is never normal to have any leakage of urine or having control issues with your bowels as well. So make sure that you speak to your treating team or your midwife if you have any concerns or issues with your continence. And if you ever are in doubt about any of the topics that we've spoken about, make sure you ask. Ask your treating team or your midwife. If you have written down any questions or any topics that you would like to discuss further with a physiotherapist, you can access us through emailing the email link that you can see on this slide here. We will endeavour to get back to you as soon as possible with your questions or concerns. Thank you so much for joining us in our Physiotherapy in Pregnancy Care class. We hope that you have been able to learn something new that will be able to help you during your pregnancy. And we are so excited for you and your families as you continue this journey in your pregnancy.